your talk actually highlighted a lot of the reasons why intersectionality is important to understand with regard to ethics research. And so I'm going to talk a little bit about my MRP and the basis for the MRP, but I want to end to talk about and make the argument for intersectionality and why we are in a critical role to actually do that, to do some of that work and to actually do intersectionality. Right? So I'll talk a little bit about what that means to actually do intersectionality. I'll start a little bit about talking about African-American women and HIV. So we all know about the decrease in incidence, but yet there being racial and ethnic disparities in HIV for African-American women, and that their voices are vital to understanding and reducing barriers to HIV treatment and also thinking about health disparities, right? So getting African-American women engaged in research. Thinking about this engagement, I think it's important to keep in mind that recruitment may be stymied by concerns about participation harms, and specifically that those concerns are rooted in historical medical maltreatment, right? So it's not just to say like, well, it's paranoia. No, it's actually history, right? And thinking about how groups have been mistreated, and often at the intersection of race, gender, and class. Right? So I give this example of Henrietta Lacks. So how many of you have heard about Henrietta Lacks? Right? So poor Southern African-American woman whose cells were used without her permission, right? And it not being acknowledged, right? Until recently, the family not knowing, right? Her DNA being used broadly, and thinking about, well, what are the ethical concerns of that, right? And Henrietta living at those intersections. And so as we're thinking about these ethical concerns that might be rooted in medical maltreatment, we also know that stigma is an additional concern in HIV research, right? And I define stigma as devaluation that's associated with status loss and discrimination, but also thinking about stigma in the research process, right? So it might highlight power dynamics that are salient and also increase concern with participation that might be linked to status loss, right? So really for my MRP, I was focused on how women who are living with HIV, African-American women living with HIV, whether or not their concerns about research are reflected in those identities, in those intersecting identities. So we already know that there's some research suggesting that medical mistrust and stigma do shape ethical concerns among marginalized groups in terms of thinking about fears about breach and confidentiality, which we talked about a little bit, concerns about privacy, which we also discussed and discussed specifically in relation to technological advances, and participant discomfort in answering research questions, and also increased psychological distress, and also thinking about consent. Right? So questions about, are we actually increasing participants' distress when we're asking them questions about sensitive things? But what we do know is that mitigating social harms is a primary goal in research ethics. But as we're thinking about mitigating social harms, we should think about that with regard to people's identities and also thinking about histories of oppression. So in terms of the research goals, I'm using intersectionality as a framework to understand how African-American women's intersecting identities might shape perspectives on benefits and concerns about participation in HIV research, and also discussing how these perspectives can enhance responsible conduct of HIV research with African-American women. Okay, so here's a little background on the method. Participants were recruited at an HIV care clinic in Baltimore, Maryland, in conjunction with Johns Hopkins University. And the procedure, participants first completed a parent study called the Women's Health Study, and it examined HIV, intimate partner violence, and mental health. After they completed that study, they did the ethics project, the ethics portion of this. So they did a retrospective study on an iPad asking about their experiences participating in the study that they just completed. So we had open-ended questions asking about perceived benefits and risks of participating in the study, which is what I'm going to be focusing on today. And we also had quantitative questions assessing stigma, which I'm also planning on analyzing soon. So like I said, I'll focus on the open-ended questions. and participants were paid $50 for participating in a gift card. Okay, so the 3 open-ended questions are listed here, right? Greatest benefit of participating, greatest concern, and also thinking about the purpose of the study. So I'll just focus on the 2 questions, right? What did women perceive to be the greatest benefit? What did they perceive to be the greatest concern? And yes, you're right, Celia, it's hard to see. So the codes that I'm going to be talking about are from Newman's Research Participation Questionnaire. And for question 1, in terms of thinking about the greatest benefits, Newman and colleagues identify several areas of benefits that people have listed in terms of engaging in research. So I had my RAs code along those areas. And they also have a list of concerns that they also measure. So the things that people might be concerned about are emotional reactions, perceived drawback, confidentiality, all of those things. Okay, so I had my participants code along those lines. And specifically what I was looking for in the codes are whether women talked about their identities. How did those things shape what Newman and colleagues have identified as benefits and concerns of research? Okay. So moving into the results, here's just a graphic of what the benefits were. So a lot of, and I'll talk in more detail in the next slides about what those benefits were. So a lot of women said that there were personal benefits of participating in the research, followed by global evaluations of the research, and then 11% of participants talked about money or other incentives, so that was not the main benefit of participation, and then participation satisfaction, a few others talked about that being the main benefit. Okay, so in terms of benefits, the opportunity for self-reflection, right? So when we say personal satisfaction, well, what do we mean by that? Women said that they had time to actually think about their lives, right? To see how they are right now compared to the past, seeing how blessed they are, okay? Specifically, things came up related to HIV, right? Helping them think about their medication, having a positive understanding of how important it is to care for themselves, right? Getting better with themselves and with their health, and also learning more about the disease, right? So these are some of the personal benefits that came up. Also, for women who said that they were in abusive relationships, that also came up as a personal benefit, and some women even said that they did not know that they were in an abusive relationship until they did the survey, right? And realized that things were unhealthy, right? So getting abuse advice and assistance. And then also sources of support. And we did talk about this a little bit, is that people taking the study feel like someone's listening to them. Even if they didn't actually, even if they were doing the study on an iPad, they felt like they had an outlet to express feelings, right? And also getting information and education from doing the study. In terms of global evaluation, a lot of people mentioned that the research was for a good cause and useful to others. And also, this I thought was interesting, they felt that they had the respect and dignity of the research team. So the research team treated them in a respectful way, right? And also, they thought that a global evaluation was that they were able to help others living with HIV. So by participating, that they were helping others. And as I mentioned, incentives did come up as a benefit, but it did not come up in as much as the personal satisfaction bit. So the incentives, though, were related to the things that I talked about with this connection between race, gender, and class, right? So thinking about the Walmart gift card helping with money expenses, right? Helping with transportation. Those are the things that came up in the open-ended questions, right? Enjoying answering the questions, and then other things that we just couldn't identify. Letting off, I want to say that's an emotional response, but, you know, RAs coded that as other. So greatest concern, for the most part, women did not have concerns about participating in the research, but about 15% of the women did express confidentiality as a concern, or responding in a socially desirable way, or emotional reactions, and also the sensitive questions came up. So with the confidentiality bit, right, it is, again, related to these intersections. So would my input stay confidential concerning the government programs that currently assist me with rent and income? people getting access to my personal records. If they participated in the study and their friend says, hey, what were you doing for X, Y, and Z amount of time? Well, would my friend ask me what was that about? Would I have to disclose to them and tell them what the study was about? That the researcher might tell, right? So even though we're consenting, folks, I do want to keep that in mind, that maybe there is still a concern that information will get out, right? That information will not be safe. And again, just other responses that could not be coded. And then people also mentioned emotional reactions, sensitive questions, and desirability around being truthful and being real with oneself, right? Just being scared in general to bring up these things. And then how people felt just in terms of answering questions about abuse or about anal sex, your risk behaviors, right? And then some participants also mentioned whether or not they were answering in the right or wrong way. So just to discuss, African American women expressed positive reactions, mostly towards the participating in HIV research, but that these responses were very much connected to their identities. And also, I think that as we're just kind of wrapping up and thinking about these things, that it's important for the research process as we think about why people may not want to participate, the validity of the study responses, and also addressing concerns in the consent and debriefing process. So even though you say, hey, we're not, going to use this information, people might still feel a little uneasy about that. So being able to kind of address that in debriefing. For a last note about intersectionality and research ethics, I wanted to add this bit in because my MRP mostly focused on women's intersecting identities, but I think intersectionality itself allows us to think about interlocking systems of oppression. So Shira's talk really highlighted those things, and it's not just thinking about societal context, but also thinking about the relationship that the institution that you work for has with the communities that you engage with, right? And that is important to understand, and we didn't assess that, but I think that it could actually have been an interesting ethical point to understand, right? Because ethical violations often do occur at these intersections, so it's important to acknowledge that history and consider how it may shape ethical concerns. And finally, when people talk about intersectionality, we often lose sight of one of the critical components of intersectionality, which is actually doing intersectionality for social justice work, to eradicate inequality and social inequities. And I think that we are in a unique position to do that because we do work specifically with marginalized communities, and we're collecting information on voices that are often rendered invisible, right? So what does that mean then in terms of how we develop interventions, what measures we talk about, methodological concerns, ethical concerns, and how can we be a voice in actually doing intersectionality? Wanted to just end on that note and say thanks. Thanks for your time and acknowledge my participants and my collaborators.
You raised so many good points, so
Yep.
I'm sure people have questions, but one of the things you raised was that Nicole took Newman's survey and some others in terms of survey research that's done, and then said, how do these qualitative responses, how do they alert us to? So it's that we don't, if you're doing qualitative research, don't ignore the surveys, because the surveys tell us something, and I think I've said that to a couple. Use some of those questions, but in a qualitative manner. I thought it was incredible, and I'm really going to think about this myself, actually, in terms of not only looking at the ethical issues, but the extent to which identity comes into those qualitative sentences. That was terrific, and I haven't thought about that, and I think all of us have those data, and we don't look at the language. How much did they talk about race, or that they're HIV, or the drug use within what we were talking about? So I just think that's fabulous. The other thing you brought up, I had never thought about, was social desirability as a concern. We are always worried about it as a control factor, and now you see they are worried about it. It reminds me a little bit of what you were talking about, Alana, in terms of, with black women, whether or not they are presenting black women well enough to you. Are they the model that they should be? But,
absolutely, because at least from a couple of the voices that I heard today, is that people do want to participate in these studies, especially if they're from communities where their voices aren't being heard, and they want to make sure they're doing it right, right? So I do think that, and it's not social desirability in the ways that we think about it, where it's just like, I don't want to appear racist or prejudiced, but it's a little bit different, but it still falls into that vein of social desirability.
And let me just finish on my thought. Okay. So then the other one is the interlocking systems
Yeah.
of oppression, which, what is our responsibility? I was thinking of your study, that when they are given that release form that you hate, you know, that she has to give them a photo voice release form. And, you know, wow, you know, how do we get at that? That's just not easy to understand, but what is it saying about not just you, but the institution to which you're
an
affiliated
institution
with?
that in its mission is centered in social justice,
Yeah.
that has something that was very clearly crafted by a bunch of really hyper lawyers. I mean, I honestly, it doesn't fit. It doesn't. I mean, and the ownership implications are also disturbing. So,
Yep.
yeah, what does that mean? I was reflecting on the same thing.
Yeah.
Right.
Yep.
So thinking about that in terms of the extent to which we are part of the interlocking systems of oppression, I think, and I told some of you, you know, when I was doing my focus group, and they told me I was an agent of the government because I had a grant.
Yes.
You know,
Yes.
and they were right.
Yes.
You know, so.
Yeah.
Not then,
Right.
now I do.
Yeah.
I always do
Yeah.
now. That
Yeah.
just sensitized me to, you know, and my privilege and all the other things that it began to
Yeah.
sensitize me to a number of years ago. And then the final thing I just wanted to say, really loved the presentation, is how do we eradicate inequality? So one way is publishing, but over the years, I have found, I don't know if other people have been on review groups and things like that, I have found, I think it's really important to, whatever I found my participants say, to voice that in the review groups. Even if nobody wants to listen to it, because they, you know, they don't, but, you know, and you become like me over the years, you have a sense, you know, there's some status in what I say
Yeah.
sometimes.
Yeah.
But yes, that we are constantly within our own raising the issues, because we've told them we're going to be their voice, and it's not enough to be their voice in a publication, but we have to be their voice with our own.
Absolutely. Yep.
I was just interested, sort of like from a methodological perspective. I think it's interesting to use the new and sort of like domain as like part of the way that you frame the way that you were doing your coding. So is that sort of a decision that you made a priori and that you directed your questions around that, or were those codes that you were looking for when you started your analysis?
So it was based on the Newman scale, right? And then I realized too that there were some things like the social desirability piece that is not in the Newman scale. So we did kind of look over it briefly to see if that framework fit, and it did. But then there were certain things that were coming up that did fit in a theme or a category that wasn't captured by Newman. And so we added those in, and then we did a round of the RAs each coded based on the, based on the criteria of the category. Yeah.
You know, remember, a lot of her study was a survey study, so she looked at a lot of surveys, but then some of these open-ended questions, so it was a priority.
Well, and the reason that I asked, I'm just thinking about some of the coding that I'm doing now in a study where
It can be posted.
Yeah, so
and also reflecting on, like, are some of these things just emerging from the
Yeah.
data, and is that a framework as you're writing up your paper to
Right.
be able to refer to?
But you know, in thinking about that too, I was also thinking, okay, well, do I code like race, gender, class, right? And I decided not to do that, because I thought, I'm talking about intersectionality, I'm talking about how these systems intersect, so it doesn't make sense to say that's an example of race, it just didn't make sense to do that. So I thought it made more sense to kind of talk about where you see these things come out in the responses in those particular categories, rather than rating identity categories themselves too. So that was something that I did think about. Yeah.
I just want to add that I think it depends totally on the context
Yes.
of how you administer the interview. Or, you know, like if you've done in-depth interviews with women about intersectionality, you probably would have wanted to code like for those
Yes.
things, because then you'd have really powerful quotes showing how it all interlocked together, like in a unique way that wouldn't be captured if you could use that kind of a priority
Yes.
framework.
Yes.
So,
And that's not right. That's not necessarily intersectional either, because we'll talk about that too,
Yeah,
but
so-
I understand, for sure.
And the qualitative work was, it was open-ended questions.
Yeah, these were
on
just
the
open,
survey.
the first
So
3
they were
questions.
writing- yeah,
right
were
after they
writing
finished,
that,
yeah.
I mean, which is-
But
that's
just to underscore, yes, your coding can be post hoc. It should be, especially for qualitative, you know? Or I was talking about, for the moral stress study I told you about. I know, all of a sudden I had to look to a literature to explain what I was finding and I had no language for. Can you define stigma again, because you were going really fast?
Yeah, so, I mean, there's many ways to think about stigma, but I simply think about it as devaluation. And you can think about it in several different ways. So how an individual might internalize stigma, structural stigma, how institutions actually devalue or discriminate against particular individuals. And that way, what one might anticipate, but it's simply devaluation. Yeah.
But I thought, what I was thinking of is that the definition can also guide the type of.
Well,
questions
yeah,
that-
so
that
that's a conversation that we'll take away from someone else's presentation
Yeah,
time.
okay.
But I'm happy to talk about that too, because, there are different ways you can operationalize stigma.
Yay!